When you're thinking about focal therapy, you do also need to think about potential downsides or things that which may not be perhaps in keeping with what you want. So we don't have quite as much data for focal therapy as we do have for surgery, which is or radiotherapy, which has been done for 50 to 70 years, something like that. So that we just don't have as much, but we do have enough, in my opinion. You also need to think about whether you'd be willing to adhere to follow-up afterwards. So you need to have regular PSA tests. You will need to have an MRI scan routinely at 1 and 3 years typically. And you might need to have more tests as a consequence of that. So the downsides of focal therapy, if you like, are that you have to be more careful about your follow-up. So if you need to be willing to engage in a program where we very carefully scrutinise you basically for the rest of your life, as actually we would do for any cancer. Cancer follow-up is usually always for life, whatever cancer you have. But with focal therapy, it's a bit more active, and so you need to be a willing participant in that process. Similarly, if you're the type of person who finds it very difficult to deal with uncertainty, where if you like things to be black and white and do not like any shades of grey, maybe you're best off just having whole gland treatment by surgery or radiotherapy, even though there can be more side effects sometimes.